Hold the scalpel between your thumb and forefinger. Make an incision directly over the center of the abscess that is oriented along the long axis of the fluid collection. Resistance may be felt as the incision is initiated, and steady firm pressure will allow a controlled entry into the subcutaneous tissues. Purulent drainage will begin when the abscess cavity has been entered successfully. Cosmetic results can be optimized if the incision is made parallel to existing skin tension lines. The incision should be extended to create an opening large enough to ensure adequate drainage and prevent recurrent abscess formation. It may need to extend the length of the abscess borders. Care must be taken to control the scalpel during the stab incision to prevent puncturing through the back wall of the abscess. The goal is to allow enough access for introduction of a hemostat to break up loculations and place internal packing. Use a swab to obtain a sample from the interior of the cavity for bacterial culture. While most patients will not require antibiotics after an abscess drainage, culture information is useful if the patient's condition later worsens and antibiotic treatment becomes necessary. After allowing the wound to drain spontaneously, gently express any further contents. Additional injections of local anesthetic may be helpful during this portion of the procedure if there is significant patient discomfort. Use a curved hemostat for further blunt dissection to break loculations and allow the abscess cavity to be completely opened up. Insert the hemostat into the wound until you feel the resistance of normal tissue, then open the hemostat to perform blunt dissection of the internal portion of the abscess cavity. Continue this procedure of breaking up loculations in a circular motion until the entire abscess cavity has been explored and any deep tracts that extend into surrounding tissues have been identified. Gentle irrigation of the wound should be performed using sterile normal saline. Appropriate wound incision size will enhance irrigation and prevent excess buildup of pressure within the abscess cavity. The irrigation should continue until the effluent is clear. Using wound packing material, such as 1/4 inch or 1/2 inch packing strips, gently pack the abscess by starting in one quadrant and gradually working around the entire cavity. Place sufficient packing to keep the walls of the abscess separated and to allow further drainage of infected debris. Overpacking may cause ischemia of the surrounding tissues or interfere with desired wound drainage and should be avoided. Appropriate packing will allow healing by secondary intention and avoid premature closure of the wound, which can lead to reaccumulation of bacteria and recurrent abscesses.